Welcome to the Patient Educators Update. We focus on patient educators and patient education topics in a clinical environment. Welcome to our very first show, and our very first guest is Fran London. Hi, Fran.
Hi.
Fran London is the health education specialist for Phoenix Children's Hospital in Phoenix, Arizona. She has published dozens of articles, and 2 books on patient education, including No Time to Teach, The Essence of Patient and Family Education for Healthcare Providers. And this book was awarded the 2010 Book of the Year Award by the American Journal of Nursing. So, Fran, it stands to reason that since you wrote the book on patient education, you should be our very first guest.
Well, thank you.
You and I have been communicating back and forth about patient education for more than a year now, I think. I think we started on Twitter.
Yeah.
And then I started reading your blog, and we were going back and forth. And early on, you seemed to be the only person out there that really was waving the flag for patient education. And I find your book, No Time to Teach, incredibly interesting. Since I'm not a patient educator, but I deal in the business a little bit, I found it very helpful to read the book and get a better understanding of really what's involved. And so with that, it leads up to my first question. Could you describe for the audience what patient education is today?
Well, it's really pretty simple. It's basically healthcare providers have to instruct patients in how to take care of themselves because we don't do it all.
Yeah. And I would imagine that there's a difference in hospital stays and things of that nature now, say, versus 10 years ago.
Oh, yeah. Patient education has become more important because people stayed in the hospital longer. There was a lot more time to teach. Right now, clinic appointments are down to 15 minutes. We really have no time to teach.
Yeah, that's pretty amazing how everything has gotten compressed so much. Well, with that as a backdrop where it's now more important, but you just said that clinical appointments were down to about 15 minutes apiece. What kind of obstacles does that put in the way for nurses and patient educators?
Well, there's the problem of attention. Just if you only have a limited amount of time and people are thinking about other things like how do I get home and how do I pay for this, you just don't have their attention in the short time that you do have.
Yeah, that reminds me of a story. My next door neighbor had bypass surgery late last year, and I went up to visit him and his wife several times while he was in the hospital, and also saw him within a day or two of them coming home, and asked them, how they felt about their stay and what they learned while they were there and what they had to do now that they were home. And it was interesting. His comment was, when the doctor was there for discharge, that was really the first time anybody had talked to them about what they were supposed to do. And he said, all I cared about was just getting out of that dang hospital because I'd been in there so long. He says, all I kind of heard from him was blah, 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 blah. I didn't pay attention. And so I asked his wife, Jan, I said, well, Jan, how about you? Did you, get a chance to talk with the doctor and understand what you're supposed to do? And she said, well, yeah, he talked to us, but I was just so worried about what I was going to do when we got home and how I was going to take care of him, I didn't really pay much attention. They gave us a couple of sheets of paper and out we went. And so we're just kind of doing the best we can right now. And I would imagine that's probably not too far from the way the reality is out there with a lot of patients.
I hear that story over and over again. That is so typical. And it's so sad because we can do so much more.
What would be some of the recommendations that you might have for nurses that want to be superstar patient educators? What should they be doing?
Well, the first thing is everybody learns in nursing school, and we really have to start applying it, is to start teaching at the time of admission. Mm-hmm. If you wait until the last minute, it's even harder to get anybody's attention.
Sure, that makes sense.
Really continual. Every time you have an interaction, you teach about something, and then you reinforce it. So that gives you a lot more time.
Yeah, that makes sense. And then you can kind of build your story as time goes on. Um, what about the role of the family caregiver? Is that more important today, especially with education?
Absolutely, absolutely. Especially because patients are in pain or they have medications that make it hard for them to hear
Hmm.
and concentrate. You have to depend on the family to get some of the information.
As you know, the company that I work for sells a video on demand system for patient education. And one of the common obstacles that we run into with hospitals is they don't value education very much. They say, no, we can handle it with a handout or whatever. We hear that a lot. So, what do you say to that?
I think the more ways you have to get the information to the patient, the more likely you are to get them to understand and to be able to apply it.
Hmm.
So
Now,
you
is there,
need lots of different ways.
yeah, yeah. And is there any research that is coming along in this that would help hospitals better understand what the potential is?
Oh, absolutely. The research in patient education is amazing in that it's really the results are very consistent, that they always come out with the same uh, findings, which is primarily that the more you involve the learner in the process, the more you have interactions with them, and the more individualized you are in your approach, the more you give them information in ways they can understand, the better the outcome. The better they understand, the better they can apply the information and change their health outcomes.
Okay, that makes sense. And that also sounds like something that we should talk about in a future episode. Dig into some of that research. I think that might be helpful for some of the folks that are listening and watching. So with that, I think we've gone a little bit over our normal planned time limit. So we'll go ahead and end this episode today. And I want to thank you for your time today. For those of you out there, if you want to keep up with Fran, she has a blog, and it is at notimetoteach.com. And you can also follow her on Twitter. She is at notimetoteach, and we'll put information in the links in the show notes so people can follow. And then also importantly, you can still find Fran's book out there. It's available in both, as they say, dead tree form and ebook form. And you can find that wherever books are sold on Amazon, and also through her publisher at p.h.com. And I believe if you go direct to the publisher, if you have a quantity purchase that you want to make, there's a pretty significant discount for hospitals that may want to purchase in quantity. Is that correct?
Yes, thank you.
Okay, cool. Okay, Fran, thanks very much. I appreciate your time today, and we'll catch up with you next week.
Okay.
Okay, you bet. The Patient Educators Update is brought to you today by Synergy Broadcast Systems and MMDS, our video-on-demand inpatient education system for hospitals and medical centers. Education to help patients and their families better prepare for successful home health care after leaving the hospital. Fran, thanks very much. We'll see you next time.
Okay, bye.
Bye-bye.